Hey guys, it's Amanda and Janelle, and we're back again to talk about a few questions, some of the questions we've been getting about the vaccines and the vaccine rollout. So we put together a quick presentation, hopefully quick, to share with you. And we're going to go ahead and get started here. There we go. And there we go. All right, so welcome to Frequently Asked Questions. I think this is number 6 because we've been doing this for a little while now, and we're going to just jump right in.
Okay, so the first question that we hear a lot is who should not get the vaccine? So who is not eligible to get the vaccine? So the first demographic is anyone who has had an immediate allergic reaction or sensitivity to polysorbate, and that's one of the ingredients in the vaccine. Anyone who's had a severe allergic reaction, anaphylaxis to a previous dose or component of either mRNA COVID-19 vaccine. And it should be administered alone. So if you got a vaccine in the last 14 days, you should hold off on getting the vaccine. And that includes the flu vaccine. You should not get the vaccine if you're displaying symptoms of COVID-19. So we've gone over those symptoms before. Anyone who is younger than 16 for Pfizer and younger than 19 for Moderna should not get the vaccine. And for those that received passive antibody therapy or convalescent plasma as a part of COVID-19 treatment in the last 90 days should not receive the vaccine at this time.
Okay, and then there are a couple of people who have special considerations. We have been getting questions about these. So pregnant and lactating women can choose to take the vaccine and should consult with their medical providers to discuss the benefits of vaccination versus the risk of COVID-19 infection. They recommend this because they didn't test the vaccine on anybody who had a known pregnancy or on anybody who was lactating in the clinical trial. However, they do believe that there is a really big benefit to being vaccinated in terms of your risk when you're pregnant of having a serious infection with COVID-19 can be higher. They think that it's higher than within a normal population of similar age groups. So they do recommend that you talk with your providers about this and kind of come up with what you feel most comfortable with. And then immunocompromised people can receive the vaccine and should consult with their medical providers to discuss the benefits of vaccination versus the risk of COVID-19 infection. And again, immunocompromised people are allowed to receive the vaccine, but they were not included in most clinical trials, except for, I believe, people who had HIV infection were included in clinical trials. And then another consideration is that if you've had COVID-19, you can receive the vaccine unless you had a severe infection, which Janelle just covered in the last point, that required treatment with antibodies and or plasma. The reason for that is that they think that the plasma or the antibody treatment, both of those could interfere with the mechanism of the vaccine, and it could make the vaccine much less effective for you. And so then you wouldn't be as covered. And so you might be walking around thinking, oh, I'm good, I got the vaccine, but your body didn't actually mount the effective immune response that we were hoping for. So these are the 3 special populations to consider.
Okay, so when am I eligible to receive a vaccine? So we get this question a lot, and as you know, it's done in phases. So right now we're in phase 2, step 1, and that started February 1st. So that is individuals over age 75 and all the phase 1 priority groups. So that's the EMT, COVID facing frontline workers. And then we are in section 3. So early education, K through 12 workers and public health workers. Unless you do have 2 or more comorbidities or you're older than 65 or 75. So we do think that phase 2, section 3 is coming up on us fast. We're just waiting to see when they give the final approval.
And a lot of the approval process depends on the supply that's given to the state. And so the state's trying to kind of open up these groups as they get the supply and as they get the response that they're looking for at all the different vaccination clinic sites. So we're sorry we don't have like a clear date, but it's a lot of it's like this supply and demand chain that's kind of coming down. And then when you become eligible to receive a vaccine, when your group becomes opened up, there is a site that you can go on, mass.gov. You can click into the Massachusetts vaccination sites. All the sites require an appointment, and then you want to go to one that's open to all eligible, all people in eligible categories, not one that's specific. So some of the sites are specific to people who work within like a certain healthcare group. They're not open to the public. They're not open to all phase workers. And then all of the vaccination sites will require a form of ID. For a licensed healthcare professional, you would want your professional license. You could do an employer issued ID card that includes your name and title. You could do a pay stub. You could provide a letter from your employer stating that you're a current employee and a state photo, or a pay stub, or a state photo ID or driver's license or passport. These are all the valid forms of ID. It's important to remember when you get the vaccine, it is a part of a 2-part vaccination series, the ones that are approved at this time, Pfizer and Moderna. And so you'll need to schedule a second dose. So for Pfizer, it will be 3 weeks from the day that you schedule that you received your first vaccination. And for Moderna, it will be 4 weeks. And it's also important to remember that the coverage from the vaccine begins 2 weeks after your second dose. And so, as exciting as it is to say, yay, I'm vaccinated, let's go out, you should wait. Hmm.
Okay, so will I get COVID-19 from the vaccine? So this is another question that we hear a lot. You will not get COVID-19 from the vaccine, and you also not test positive after receiving the vaccine. And that's because the mRNA vaccine teaches the cells how to make a harmless protein that is unique to COVID-19, but we're not giving you COVID-19. So this harmless protein then triggers an immune response to produce the antibodies that protect against the COVID virus as it enters the body. But after our cells make copies of the protein, they destroy the mRNA from the vaccine and it's not held in your body. So it's really important to understand that this isn't a live strand of COVID that you're receiving. So you will not test positive. There's no chance that you can get COVID from it. And it's just your body's antibody immune response reacting to the mRNA vaccine. So it's really important that you guys understand that.
And the mRNA process of replicating proteins is a process that our body uses all the time to build proteins that are used in different parts of our body. So the RNA from the actual virus doesn't enter your cells in a way that could produce live virus. It's not live virus in the first place. It's just like a messenger that then your body is able to use to replicate different parts of the virus that can key specifically to your immune system. So it's very cool. And I also got a question that was similar to this, which was, if my loved one received the vaccine and they were showing symptoms, are they infectious? And again, the answer is no, because your loved one didn't actually get the live virus and wasn't infected with the virus. They just were producing an immune response. So that just shows that the shot that your loved one got was working, which is a good thing. Yay. All right, so which vaccine should I get? Both vaccines are comparable in terms of efficacy and the side effects and the contraindications. They're very similar. So both of them are mRNA vaccines that work in the same way. They have a similar efficacy rate, so a 94.1% efficacy rate in clinical trials with Moderna, and a 92% efficacy rate in clinical trials with Pfizer. So whichever one's available. Get the one, get the one. Oh.
Okay, so we also get a lot of people asking us, what are the side effects of the vaccine? So there's expected localized effects of the vaccine, and that's something that you would expect with like a regular shot. So that's pain, swelling, redness at the injection site, that type of thing. And then there are systemic side effects of the vaccine that seem to mimic flu-like symptoms. So that could be fever, fatigue, headache, chills, tiredness, that type of thing. The post-vaccination side effects do not commonly include cough, shortness of breath, or runny nose. If you have any of those side effects that I just listed, you should contact your healthcare provider and the health office to let us know, and we can go from there. So most of the symptomatic flu-like symptoms that happen after the vaccine are mild to moderate, and they occur within the first 3 days of vaccination, and they resolve within the first 1 to 3 days of onset. So this timeline is very important too for us to understand if you're having systemic symptoms of getting the vaccine, or if you may have contracted COVID-19 during that time, because that is still possible. As Amanda said, it takes a little bit of time for your body to have the immune response for you to be vaccinated fully. I also wanted to mention that those with the dermal fillers, so those are typically like the facial fillers that you see people with. There's been reports of swelling at the location of the fillers. So that's not a medical emergency, and it can be treated through your primary care doctor. So if this happens, we do recommend that you call your primary care. And finally, the biggest side effect of the vaccine, or the most important rather, is the risk of anaphylactic reactions. So that's a whole body, multi-systemic allergic reaction to the vaccine, and that is a medical emergency. So if you have any hives, throat closure, your throat feels a little bit tight, anything like that, difficulty breathing or confusion, upset stomach, you should if you have an EpiPen, administer it, and if not, proceed to the nearest hospital because you may be having an allergic reaction to that, and that is a time-sensitive thing to get taken care of.
And the reassuring thing has been that with the anaphylactic reactions that we have seen with both of these injections, both the Moderna and the Pfizer, most of them have occurred within 15 minutes. And
Yes.
so they're having everybody in the population wait for at least 15 minutes after you've received your vaccination. And then anyone who has a prior history of anaphylaxis for any reason is supposed to wait for 30 minutes for observation. And all of the vaccine sites are equipped with EpiPens and with first aid treatments, and would be able to assist you if that were to happen. So a reassuring point there. Okay, so considerations. I think we've covered this a little bit. But it's very important that you continue to social distance and wear masks after receiving the vaccination. One, the vaccines are not 100% effective. When you hear the words 92% and 94.1%, what we're talking about is efficacy in clinical trials. So that means that was comparing the rate of infection on people who received a dose of saline water versus people who received a dose of the vaccine. So that does not necessarily mean that you're 94% less likely to contract COVID-19. So please, especially with the contagious variants, please continue to social distance and wear masks even after you have been vaccinated. And travel is not recommended after vaccination due to a chance of contracting COVID-19, especially in areas of higher community spread, which are a lot of places right now. So you will still need to follow the travel advisory. You'll still need to follow the travel advisory for work. You should still continue to monitor for your symptoms daily, including temperature checks. And we'll be providing a form with this email, with this presentation, that goes through some symptoms that you should report to the health office if you experience an increase in body temperature or any side effects that seem like they might be COVID-19 after the vaccination. This will be like a decision-making guide. If you look at it and you have questions, or if you just want to go directly to your health officers, please do. And we just want to reinforce that it is important to continue to remain diligent after receiving the vaccine. We don't anticipate that our health policies and procedures are going to change anytime soon. So everything we've been doing, we will continue to keep doing because you guys are awesome.
Okay, so like Amanda just mentioned, our policy for illness after vaccination is going to be staying the same. So it's really important that you continue to self-monitor every day for the development of symptoms. So that means taking your temperature and listening to your body. Does it feel off? And letting your program nurse know if you have any new symptoms so we can figure out if it's a COVID related thing or not. And then we'll make appropriate steps as needed, determined on that assessment. And we do want to remind you that since the vaccine is not 100% effective, we will still be requiring PCR testing and quarantining depending on the symptoms that you mention. And as Amanda said, we don't anticipate changes to our health office policies for the immediate future just because of the current state of the pandemic that we are still in, the variants, and there's a lot of moving parts with that. So keep your nurse in the loop, and we'll make the best decision to keep everyone safe.
All right, and we are including a copy of this presentation with the email. And so if you have any further questions, if you want to click in to see some more information, I think this link is specifically about the Moderna vaccine, then that will be available. And the form that I was mentioning that goes through the different side effects that might happen post-vaccination will be included as well, and a summary of what we've talked about on this slide. And we just want to say thank you to you guys for everything that you are doing and have done. You guys 100% are amazing and awesome. And we are excited to work with you. And we are very excited about vaccinations. I had the opportunity to get my vaccine today, and it was the most excited I've ever been getting a shot in my whole entire life. So thank you guys for everything you're doing, and we'll talk to you guys soon. Bye.